Our next speaker is Tine de Marez from Janssen.
Hi, I'm waiting for my slides. But I guess I can get started with just thanking the organizers for inviting Janssen. We're very happy to give an update today again on bedaquiline. Let me see. This is a slide that you're probably very familiar with by now. This shows you the bedaquiline clinical development program. As you all know, we received accelerated and conditional approval based on phase 2 data. In the middle of the slide, you see the phase 2 trials listed. C208 stage 1 and stage 2 were conducted in MDR and pre-XDR-TB patients, and then the C209 study was an open label study conducted in pre-XDR and XDR-TB patients. We did have a pre-approval access program, which since has been concluded, and we are now focusing on our post-marketing commitments, the phase 3 study, a pediatric study, and a registry. Over the next few slides, I'll give you a little bit more details on some of these post-marketing commitments that we have, as well as on some other initiatives we're involved in. But first, I'd like to show you this slide. On the top of the slide, you see where Certuro or bedaquiline has been registered, starting in 2012 with the US, followed in 2013 in Russia, and in 2014 in Europe. I won't go through all of the flags, but just recently we also we're very happy to receive approval in China as well, and very recently in Moldova. On the bottom of the slide, you see the countries where we have submitted bedaquiline for registration. And I think the note here is that at this point, we have really submitted the file in countries that represent more than 80% of the MDR-TB incidence globally. The pediatric trial. This is a study, a PK and safety study. It will be conducted in pulmonary MDR-TB, pre-XDR-TB, and XDR-TB. We are looking for at least 60 patients. Currently, we're enrolling in the 2 oldest cohorts, the adolescents and the older children. We have 8 patients enrolled in the adolescent cohort and 3 in the older children cohort. We are expecting a 9th patient tomorrow in the adolescent cohort. Once data are available from the older children, so from the 5 to 12 years old, we will be opening the younger cohorts sequentially. The adult tablets are used for the adolescents, and we have a pediatric formulation, a water dispersible tablet, that's being used for the other cohorts. Intensive PK is done at weeks 2 and 12, and we have interim analysis done in each cohort. And as mentioned, we open the next cohort after data on at least 12 subjects are available. So we are enrolling in South Africa, Russia, and the Philippines. And India is expected to enroll this year, to start enrolling this year as well. A couple of words on the multi-country TB registry, or also referred to as real-world evidence. So basically what this is it's a phase 4 clinical trial. It is open to all MDR or any MDR-TB patient, whether the patient is on bedaquiline or not. We have activities ongoing in South Africa and South Korea, and country selection, just as an FYI, is based on the strength of the treatment programs in that particular country, the interest, of course, from the country, whether the country can adopt elements described in the WHO interim policy guidance on bedaquiline, which includes commitment to strengthening pharmacovigilance if necessary, and then also whether there's a permissive regulatory environment. Then DREAM. DREAM stands for Bedaquiline Resistance Emergence Assessment in MDR-TB. It is a global drug resistance surveillance study. It aims at monitoring the development of resistance to bedaquiline and amplification of resistance to fluoroquinolones, second-line injectables, and WHO Category 5 drugs over 5 years. The participating countries are listed on the left there, and it's expected that by the end of the year we should have 4,623 isolates for analysis. Now, this slide I added in last minute since the WHO report became available. So I think most of you will have seen it. It became available a couple of weeks ago. We pulled this slide out because we thought it was interesting to show at this venue as well. This shows a comparative mortality analysis using retrospective data from the South African Electronic Drug Resistant Tuberculosis Registry, so the EDR web as referred to. On the left side, you see, or the first column, you see the patient's characteristics, and then there's two groups there, two cohorts, if you will, listed there. A cohort of 1,556 patients that received bedaquiline, and then next to that, a cohort that has not received bedaquiline, the letters are really small from here, 25,000 something, 23,000 something. What we would like to draw your attention to is to what's in red, and that's the mortality. So there's 7.6% mortality in the group that received bedaquiline versus 18.2% in the group that did not receive bedaquiline. So this slide here, I'm not going to go through in detail, but it lifts out certain populations there on the left, and the results speak for itself as well. So I think we were very excited to seeing these results, as it indicates a 50 to 60% reduction in mortality when bedaquiline is added to a regimen. This slide shows you the overview of the bedaquiline-containing regimens that are currently being studied by various groups. First of all, the STREAM Stage 2 study, which is also our post-marketing commitment, which studies bedaquiline in 6 and 9 month containing regimens. Then next we have NTB, the programmatic use, and then also the MDR-TB studies that study bedaquiline and the laminate in a 4 to 5 drug regimen for 9 or 6 months. Practical is coming up next, so I won't say anything about that, and also NICS is coming up next, so I don't have to say anything about that either. And I think Otsuka already mentioned the bedaquiline, the laminate DDI study that's ongoing as we speak. We do have also bedaquiline added to the next trial in South Africa, and then lastly a 3 to 4 drug regimen that includes bedaquiline and the laminate that will be is currently being or will be tested in South Africa. Now, given the unique nature of MDR-TB and the public health landscape, we do at J&J feel it's very important to work with global stakeholders, not just to ensure access and appropriate access, but also to incentivize R&D, to possibly work on alternate advocacy models. So this slide really shows you some of the partners we're working with. I can't go through each and every one of them, but I'd like to lift out one, and that is the Sirturo donation program we have with, we're working with USAID on. It's a 4-year program. Up to 30,000 treatments for eligible patients are provided at no cost, and over 100 low and middle income countries. Countries need to be Global Fund eligible and use bedaquiline in accordance with WHO guidelines. Countries that are listed on the left are the countries that have received shipments already. So the impact to date is really that we have about 5,000 orders that were placed. So far, 2,796 shipments have been made. We're 2 years into the program, so we had hoped to see a bigger impact by now. So I think there's a couple of lessons learned that we will have from this program as well. And I think that was my last slide, so I'm happy to take some questions.
Any clarifying questions?
Yes, I just wanted to clarify that drug resistance surveillance is also ongoing in the U.S. under the U.S. CDC.
You need to provide me with your updated slide, Connie.